Getting doses of a COVID-19 vaccine, first to the people who need them most and then to everyone else, is one challenge that state, federal, and local officials face. Another, though, is to make sure people actually take it.
We have been tracking the public's views, experience, and knowledge of all aspects of the pandemic since March. But perhaps nothing has been more front and center for us than this question of how people will react once the vaccine becomes available. What you see here is data across a number of pollsters, and it's a picture of how the public has reacted to the idea of a hypothetical COVID-19 vaccine. You notice that early on in the pandemic, large shares of the public reacted positively to taking a vaccine once available. But as the pandemic continued, and frankly, as the situation became more and more polarized and politicalized, you'll notice that fewer people were certain that they would take the vaccine. First, there's a very big difference between the hypothetical and the actual. And so far, and for the most part, we've been asking people about their likely actions in a hypothetical situation. And second, largely because of that, this is going to be a dynamic environment, and the public's reactions will vary as the news of the day changes and as we start talking about actual vaccines reaching actual people and their success and their challenges in doing so. Note here that when we go the next step and ask people who are actually resistant to tell us in their own words what it is that they're worried about, Black adults are most likely to mention safety concerns followed closely by distrust of the healthcare system and government. Whereas on the other hand, for white adults, but particularly those who identify as Republican, they're more likely to tell us that they just don't need it or they just don't want the vaccine.
So few things in health policy are simple, but in the case of the COVID-19 vaccine, there is a very simple take-home message, which is that no one going to get the vaccine will be charged for the vaccine or its administration, no matter what type of insurance they have or whether they have insurance at all.
Hesitancy in this case is a very valid response. There's, as I said before, there's so much uncertainty and there's so much that's not known that I don't, this is not the same as when we talk about anti-vaxxers who have, very specific reactions about vaccines more generally. In most of these cases, we're talking about Americans who generally get a flu vaccine. They often, get all their other vaccines, but there is so much uncertainty at this point in time that they are hesitant. And I think in many cases, appropriately hesitant about whether they want to be first in line for this vaccine.
We're still in the middle of one hell of a crisis. And so we've got a lot of work cut out for us on every front.